So Deborah asked, did you wear a brace after your knee replacement surgery? If you did, how long did you wear it? Her surgery is scheduled for the end of October. She's in Michigan. The weather gets cold. She was thinking about what kind of pants she should wear for going to physical therapy visits. So typically, patients don't wear any kind of knee brace following a total knee replacement. I have known surgeons who will recommend a version of like a Neo Mobilizer to help improve extension, especially if somebody is struggling to gain that end range of motion into extension. The Immobilizer brace is just like it goes from the thigh down to the ankle. It's got straps that go over it with padding and some metal bars. And it's designed to really just keep the leg in extension, knee extension. I think it works for the right person. I don't think it's something that necessarily everybody would need to use. But generally speaking, unless there is some sort of deficiency in the knee. Now, I have known patients that had ruptured MCL or LCL, which are the medial or lateral collateral ligaments. Their knee became very unstable. They did choose to wear a stability brace. But generally speaking, the vast majority do not ever wear a brace, so you can wear any kind of pants that you want. But I would recommend you wear a pair of pants that either you can pull the pant leg up to about mid-thigh to expose the full incision, or you wear a pair of shorts under your pants so you can take your pants off when you arrive at therapy.